Hello, everybody. I hope that you're doing well. Welcome to the third week or recap of your third week of year one in the respiratory therapy program. This week, you would have gone over or had a continuation of principles of infection control and prevention, ways in which to prevent infection. Uh, in clinical, in your clinical course, you're still going over how to perform hand washing, how to put on sterile gloves, how to don and doff your PPE. Again, don is to put on your PPE, how to take it off. The disease processes by which you would be utilizing said PPE, like we mentioned last week, utilizing an N95 mask or HEPA filtered mask for airborne type precautions such as tuberculosis, what have you. Also know that those individuals are going to be placed in a negative pressure room, and those negative pressure rooms have to be lined with those HEPA filters, the highly efficient particulate aerosol filters as well. Continuation of how to utilize and manipulate your e-cylinders. So you've been learning how to crack the cylinder, how to place the regulator on, how to utilize the O-ring so that you get a good contact with the regulator and the cylinder yoke on the valve stem of the e-cylinder. You've also learned the cylinder factors. We remember the two we were going to focus on, E-cylinders and H or K cylinders. So E-cylinder, the cylinder factor for duration calculation, 0.28. And then for your H and K cylinders, remember that's as easy as pi, 3.14 for both of those. To calculate your cylinder duration, it is gauge pressure or cylinder pressure times the cylinder factor divided by your flow, which you would see that on the regulator, whether it be one that you prescribe flow amount, whether that's 1 liter per minute, 2 liter per minute, 3 liter per minute, and so on and so on. And then you want to continue to break that down so that you can report that answer in hours and minutes if you are going to calculate cylinder duration calculation. Here in the coming weeks, we're going to go over some ethical and legal implications associated with respiratory therapy. Additionally, we'll start to talk about the patient interview, the basics of going in and taking care of your patients. So you're still getting feet wet. I know this is relatively short. It was a relatively short week given our academic calendar, the way that it broke up this week. So not much of a significant review on pharmacology this week because you all did not have pharmacology this week due to the way that the academic calendar fell. But you do have your first test coming up that's going to cover the first couple of chapters, as I understand, with speaking with your pharmacology instructor. So you've got the general principles of pharmacology, understanding the basics of your pharmacokinetics, your pharmacodynamics, the medical terminology associated with that. You've also got chapter 2, which went over to your drug dosage calculations, and then upon completion of that exam, you're supposed to move forward into chapter 3, which is going to go over the autonomic nervous system. The autonomic nervous system, there's a lot of terminology associated with that. So to piggyback to 110, you're learning your medical terminology. So try to remember what your prefixes mean, what they stand for, what your suffixes might mean, what those are standing for as well, as long as the root word. And if you know those word parts, you can piece together pretty much any type of word that you're looking at. There is quite a bit of vocabulary in the upcoming week for pharmacology, so be prepared for that. There are a lot of different names that might mean the same thing. So, for instance, if you're going to utilize an anticholinergic agent, could also say that you're utilizing a parasympatholytic agent as well. So a parasympatholytic or an anticholinergic essentially mean the same thing. So vocabulary cards, what have you, may be beneficial for you moving forward. With breaking down the autonomic nervous system, so the autonomic nervous system is broken up into two different parts, your parasympathetic and your sympathetic system. The easiest way I can explain for you to study and be prepared for that is to remember what one system does. So if you can remember the division of the sympathetic nervous system, your fight or flight system, or if you can remember the division of your parasympathetic system, your rest and digest system, the stimulation of the other system will have the opposite effect. For instance, we'll look at sympathetic versus parasympathetic with heart rate. Heart rate, sympathetic stimulation. So if you stimulate the sympathetic nervous system, that will cause you to have an increase in your heart rate. Or if you're utilizing medical terminology, it will give you a positive chronotropic effect, as opposed to where if you have parasympathetic stimulation with regard of the heart rate, that's going to cause a decrease or a drop in your heart rate, or a negative chronotropic effect when we're looking at that. So it's probably a little early to introduce some of those terms, but I'm going to do it anyway. So chronotrope is in reference to rate. Inotrope is in reference to overall force of contraction, and dromotrope is the rate of conduction. Typically, you can be positive or negative of those. If it's positive, it's going to increase that. If it's negative, it will decrease it. Uh, but just remember between the parasympathetic and the sympathetic system, if you can remember what one system does, what stimulation of one system does, stimulation of the other system is going to have the opposite effect. Uh, just like salivation or saliva in the mouth. Your rest and digest, the parasympathetic system is going to be heavily involved when you're getting around, sitting in front of a sandwich and getting ready, and you may begin to feel your mouth water a little bit. Your body's getting ready to begin to digest the food that you're getting ready to take in, as opposed to, so that is stimulation of your parasympathetic system, as opposed to where if you've ever noted that might feel a little amped up, like you're sympathetic, the adrenaline rush. You may notice your mouth gets a little bit dry because those secretions are going to dry up during that period of time. So stimulation in that regard, where the parasympathetic increases secretion production and stuff in the mouth, saliva production, stimulation of the sympathetic system would decrease that amount. So it really truly is as easy as remembering what one system does. The other system is going to do the opposite. Coming forward in the next couple of weeks, you'll get into medical gas systems administration. I know you touched on that a little bit. We've covered some of the safety system because I heard some of you talking about that the other day with the American Standard Safety System, the pin index safety system, or your diameter index safety system. American Standard Safety System is going to be on cylinder with regulators on cylinders larger than an E cylinder. Pin index is going to be on the cylinder smaller than an E cylinder and smaller. And then the diameter index safety system is going to be utilized on your station wall outlets. You've got different diameters for different gases, and you can see those in the labs when you look. Air is quite a bit larger than oxygen. Vacuum and air are similar in nature, but they are different. That prevents you from hooking something up to the wrong outlet, or in the case of vacuum, hooking it up to an inlet. And diameter index safety system typically going to be utilized with pressures less than 200 pounds per square inch. And remember, our working pressure for respiratory therapy equipment is 50 psi. So those cylinders that we're working with, if they're full, they can be as full as 2,200 pounds per square inch. And then you've got reducing valves and regulators that can reduce that area of high pressure down to what our line pressure would be, or our working pressure for our respiratory therapy equipment, which is 50 psi. So quite a bit that we've gone over in just the first 3 weeks. Hopefully you finding these weekly reviews a little bit helpful. If you need me to go over anything else in more detail, please feel free to ask. I'm happy to do that. But nonetheless, week 3 is a wrap. We look forward to week 4. Have the first exams coming up. That should be good. And we'll just keep on keeping on. You all keep up the good work. I see you all staying late in the labs and putting in extra time work, study groups that develop. So I commend you all on the work that you're doing. Thank you all very much for your hard work. Keep it up. Keep going. And we'll see you next week with the next update.